So cupping is a tool that you can use during your therapy session that can be placed onto the patient's skin. The nice thing about it is you can just stick it on there and you can see how the skin is reacting to the cup, which is really nice. So that way you can see, oh, okay, it is not liking that at all. Or you can also see how fast somebody's skin turns red, which that can also be a sign of dehydration. And what it does is it helps pull the layer of fascia apart to bring new blood flow to the area. So it causes trauma to the area, but it's meant to heal the area. So sometimes trauma, forced trauma can help with the healing process, which is really nice. And it's also great if somebody only has a short amount of time that needs a lot of work done. The cupping can be on one side of the person's back, and then you can be doing some deep tissue on the other side and then just switch it to the other side when you're ready for it. It's really good to help with, like I said earlier, separating those layers of fascia, bringing new blood flow to the area. People that have a lot of knots that are just being really stubborn, that just don't want to let go, you can place it onto the area because it will create this vacuum seal and help get those layers. That's why it helps separate the layers, is because of that vacuum seal. One of the most common questions I get asked is the markings, and is it painful? When it comes to the markings, they can last anywhere from, I've seen some people, they just have markings for that session. They're completely gone by the next day. And then some people, it lasts them about 3 weeks with those marks. Just depends on how much water you're having. And it really doesn't hurt too much. It just depends on where you're cupping at and how often cupping gets done, because your body kind of starts to get desensitized to it. I have always found that the legs tend to be the most painful when it does come to cupping, but for the back, some people, they don't even realize that cupping is happening. And I want them to be comfortable with me before we start to try something that they've never done before, because then it kind of helps establish that foundation of trust.